I fundamentally believe that self-care is not just important, it's absolutely fundamental to the sustainability of the NHS going forward. We see over 300 million consultations in general practice alone in England, and if patients are actually going to become healthier and the NHS is going to be sustainable, we have to address self-care. Self-care is about helping our patients and working with our patients to look after themselves better. It's about enabling them to have the knowledge and the confidence to know when they need to see a GP or a pharmacist or another healthcare professional, to actually give them the support they need to look after themselves and lead happy and healthy lives. I think there are many advantages. There are advantages for the patient, for the practice, for the local health economy, for commissioners, and actually for the NHS as a whole. I think for the patient, it actually gives them the confidence and the ability to self-manage their conditions, many of which they have to live with throughout their lives. It actually makes them much more aware about how to optimise and take control for things which actually then improves their outcomes, their health outcomes. In terms of the practice, I think it's absolutely vital with decreasing resource that we target our efforts where they're most needed. And if patients are actually using the services appropriately, they may well go to the pharmacist for their medicine, they may be signposted to other healthcare professionals, freeing up time for those patients who actually need medical input with chronic long-term conditions, for example. In terms of the local population, we need to get patients to be much more aware of what is healthy and what is unhealthy and actually use resources appropriately. For example, not just turn up at A&E if actually it's something they could manage themselves with the proper support, education and advice which is available elsewhere. And in terms of commissioners, I think it's absolutely vital. We have an ageing population, we have so many demands on us and a decreasing budget. We must target our resources, actually help people to be healthier, to make the right lifestyle choices, which at the end of the day is going to have a huge impact on the sustainability of the NHS. I think the most important thing is that we stop burying our head in the sand. This isn't a problem that's going to go away, and that's why the Self-Care Forum has called for action. We have to start addressing these issues now. We need to start telling patients what the real cost to the NHS is actually for them going with their sore throat or minor ailment, that actually they may well be of better benefit looking after themselves. For example, it takes the average family 13 hours to earn the tax to pay for a GP consultation, which actually you could argue would be much better effectively spent in a different way. So actually the message that we need to show is that not only do we need to help patients by showing them how to look after themselves better, we actually need whole system change. There are many things we need to do, which is the reason that the Self-Care Forum has actually come up with a 6-point action plan, which we need to really get going with now. Just a couple of examples. Actually, if we address demand, if we actually enable patients to look after themselves, then we can free up capacity to actually improve the quality of care, the length of consultation, the complexity of what we're doing in general practice to other patients, for example with long-term conditions. This obviously could have a positive effect on our referral patterns and actually how we actually actively manage those patients and keep them out of hospital, which actually we all know is absolutely vital with the NHS straining as it is at the seams. The other thing that we need to do is actually as commissioners think about how we enable this to happen. We all know that GPs are really busy. We all know that demand has increased year on year as patients' problems get ever more complex and they need to see the GP for routine checks as well as obviously their acute health needs. What we must do is actually enable the system to have the time and the capacity to actually have that conversation in every consultation. So what I would like commissioners to do is to actually incentivise self-care, both through national incentive schemes and also locally. This is absolutely vital we do this. The time for action is now, and that's why I'm absolutely